Okay, let's talk about ACS. What is ACS? ACS stands for Autologous Conditioned Serum. It is our staple procedure behind our non-surgical hair restoration program. ACS is a wound healing therapy that's derived from your own blood. Why is wound healing therapy important or analogous to hair loss? Well, consider this. When you have a cut, you need skin and hair cells to replicate to close up the wound. You also need blood vessels to grow and nourish the wound itself. And that is what hair loss needs to regenerate new hairs. Remember, the process of hair loss is testosterone converting into DHT, DHT binding to your hair follicles, dropping the metabolism of these hair follicles down, causing them to thin. At the same time, your body responding by decreasing the blood flow to these hair follicles, and then the hair never being able to grow thicker than that blood flow allows. It's a cyclical effect. And we can actually break this by increasing the metabolism of the hairs. And we have no good therapies besides ACS to really rev up the metabolism of the hairs. We have good therapies to block DHT, good therapies to increase blood flow, but this is the centerpiece of actually getting the metabolism of the hairs off to actually get those hairs thicker. So in ACS, what we're trying to do is actually boost the thickness of the hairs to their maximum ability. And then from that point on, sending you on a home regimen that's going to help you maintain the new thickness which you achieved. So how does ACS work? Well, you're going to come to our office. We're going to draw your blood. We're going to isolate cells involved in the wound healing process. These are neutrophils, white blood cells, platelets, in addition to the plasma. Once we get those cells, we're going to isolate them, concentrate them, and we're going to put them inside of a syringe. And in that syringe, we're going to activate them right before we inject them into your scalp. We're going to do this 4 times over 6 months. This is going to create a wound healing environment in the thin hair area to promote thickening of the hairs. Once these 4 sessions are done, we do not really plan to do ACS again. We want to use your home regimen to maintain the thickness that you've achieved. However, some people will note that over the course of a year, the hairs will thin again. They'll come back in for one more ACS session to see if they get the hairs to boost up in thickness. And very often it will, because it is such a good therapy. And they'll include ACS maybe once every 2 years in their process. But ACS, again, it's a bloodborne therapy that's based upon wound healing principles. That's been our major treatment for non-surgical hair restoration. It's what we use to thicken up the hairs and then place you on a home regimen to help you maintain those results over time.